I'm Eric Shaw. Now time for a Sunday House Call.
And I'm Julie Banderas in for Arthel Neville. Welcome, everyone. Joining us, of course, Dr. David Samadi, Chairman and Professor of Urology at Lenox Hill Hospital and Chief of Robotic Surgery, and Dr. Marc Siegel, Professor of Medicine at the NYU's Langone Medical Center, also author of The Inner Pulse, Unlocking the Secret Code of Sickness and Health. Okay,
Doctors,
we want to begin.
Great to see you.
As always.
Thank you for coming in. Now, once again, we've been talking about Maryland Governor Larry Hogan, his diagnosis, set to begin 4 days of chemotherapy starting tomorrow. The governor undergoing treatment after announcing he has stage 3 non-Hodgkin's lymphoma. Dr. Samadi, stage 3, he still is a treatable patient. Tell us about how they plan on treating him.
Well, this is a fairly aggressive cancer that he's having. So when you talk about lymphoma, which is a cancer of lymph nodes, they come in Hodgkin's or non-Hodgkin's, which is what he has. Non-Hodgkin's is more common, and the B-cell non-Hodgkin's is actually 90% of the disease that we see in lymphoma. That's what he has. So the stage 3, as you mentioned, is a very key and important information because that's fairly aggressive. That means that it's on both sides of the diaphragm and there are multiple lymph nodes. The way they biopsy this is someone would present with a big lymph node and it doesn't go away. They may have some weight loss. They may have some night sweats or fever. They biopsy that, then they find out that it's lymphoma. Then they get a CAT scan and PET scan and they realize how far it's gone. Most of the treatment is chemotherapy, which is what he's going to get. They may treat him with some immune therapy and Rituxan to boost his immune system. But when you look at the 5-year survival, usually for stage 1 is about 80%, for stage 3 should be around 60%. So there's absolutely, a hope. And we don't know what the cause is, Julie. A lot of times could be genetics, could be environmental. Agent Orange could be Epstein-Barr virus. Nobody knows exactly why this happens.
Mark, what's interesting about this is that he found it in his neck, he said, when he was shaving. I mean, do you feel this beforehand? He said it was a huge lump. Why wouldn't you be able to detect that before it gets to that point? And when we shave as men, what should we do?
I knew you were going to ask that question because you want people out there to say, how do I know I don't have this problem? And the answer is that most people would feel it before it got to that stage, man or woman. I mean, obviously, men are the ones shaving up here. But people all the time are coming to me saying, hey, I found this little lump here. What is this? And the answer is, if it's freely moving and it's tiny and it's rubbery, not hard, chances are it's not lymphoma. If it gets larger and it's matted, meaning you have trouble moving it and it gets really hard, that's more likely that it's something to worry about. And as David was mentioning, in his case, he has stage 3, which is above and below the diaphragm. You got to look for lymph nodes in your groin, under your arms, on your neck. If it's an area where there was a recent infection, Eric, like you had a sore throat and you have these nodes that persist, or an ear infection and you got a lymph node here that stays around a while, that can be totally normal. Another thing I want to mention here, David mentioned Rituxan. That's been a game changer. Rituximab is an antibody. That's what we mean when we always talk about targeted therapy here. It targets a protein on the cell. Lymphoma is a lymph node. B cell, as he said, that makes antibodies. Lymph nodes make antibodies against invaders, against infections. Well, Rituximab is a monoclonal antibody that targets for destruction that malignant cell. And then you put in the chemo on top of it, and that's why you get a 60-70% 5-year survival rate. We've helped fight this disease.
I think what's important is also what you just mentioned. When you have an isolated lymph node that just pops right there, you want to pay attention to it. Now, a lot of people may or may not know what lymph nodes are for and what's the purpose of this. Think of it as a sewer system. When you have like a day like this where you have rain, all of this goes in the sewer system and it leads somewhere else. That's exactly what lymph nodes system and the chain is doing. Instead of having any blood in the vein and arteries, you have these lymphatics that if you have an infection, you're going to have swollen lymph nodes. If you have cancer, sometimes they can metastasize. You may have, for example, prostate or bladder cancer that can metastasize. That's not what we're talking about. This is the original form of cancer in lymph nodes. And obviously, we pray and we hope that he does well, but there's a lot of hope. He's going to go through a big battle through this. But the prognosis depends on how he responds to chemotherapy.
Early detection is always key in cancer,
Absolutely.
Obviously. But this does react well to chemotherapy, even at a stage 3. Dr. Siegel, you mentioned about, feeling lymph nodes in your groin, in your armpit, in your neck. Do we look for pain? Is there any discomfort associated to this that we should be aware of?
Great question. Usually not. But you know what else you look for? You look for these lymph node swellings. You look for fatigue. Now, I'm going to give you some symptoms that are pretty nonspecific, but if you have them, you better go to the doctor. Night sweats, that sweats at night, fevers at night, weight loss, and profound fatigue. And then if we check, we might see you're anemic. And then these lymph nodes can be floating around and not be painful. If they can be painful if they butt against the nerve. So it's either or. It could be the painful and not painful, but the key is that they're hard, they're very firm, and that they're not freely moving.
Especially if you lose weight without trying. That's a huge red flag. The question for Marc is, how do you distinguish between a lymphoma
and a cyst
and a lipoma?
Okay.
That's another one that comes up all the time because, maybe you want to answer that.
And I get that all the time. Absolutely. The lipomas are fat cysts, and they're squishy. They're squishy. I get used to it after a while. And I don't want you at home to do this. Eric, Julie, I don't want you doing this at home. Come to the doctor and let the doctor tell you. But if it's very hard, it's more likely something like a lymphoma. If it's squishy, it could be a fat.
Can this come up in the blood testing? You go to the doctor, you get that big long list of stuff, you have no idea what it says.
Yeah.
I mean,
sure,
does this come up?
You can see probably a lot of times your white count may be completely out of control. But once they feel that lump, and to distinguish between a lipoma and lymphoma for a regular person is difficult. But they would biopsy it, and a lot of times, Eric, they may even get a biopsy of bone marrow because that's also related. And by the way, thymus and spleen and lymph nodes are all connected as part of the immune system. That's one of the reasons this monoclonal antibody reacts really well. So we are getting better with this. Obviously, Hodgkin's has a better prognosis.
Is there any kind of screening? You talk so much about prostate screening.
That's
there are
right.
all different types of screening in order to catch this before they come, because it's scary stuff listening to you guys talk about
Yeah,
this.
it's interesting that you asked this because when it comes to Hodgkin's lymphoma, it's a bimodal age, meaning that you would see it around like 15 to 30, then you don't see anything until like around 55, 60. With this non-Hodgkin's, usually as you get older, the risk becomes higher. You see this usually over the age of 60. So if you have family history, if you've been exposed to some of these Agent Orange, etc., or benzene, you absolutely want to go to your doctor and have it checked. That's a very good question.
I want to state the obvious, which is if it's getting bigger, get it seen.
Right,
That's the bottom line. Scan yourself for these lymph nodes. Don't be embarrassed, especially men. We talked last week about how men never go to the doctor. And David has started the Samadi challenge, which is to get women to get men to go to the doctor. You know what, men? If you have one of these things, go to the doctor.
Don't ignore it.
That's right.
That's a very good point that Marc is bringing up. Just don't ignore it because, as Julie mentioned, you catch them early, cure is way up there.
Well, certainly our thoughts and our prayers are with the governor that he has a full recovery and that he has caught this in time.